students. Now this question is describe the anal canal under following heads. Introduction of the anal canal, its relation, then its interior structure of the anal canal, okay, as seen from inside. Then what are the anal sphincters, blood vessels, lymphatics, nerves of the anal canal, and lastly the applied anatomy. Now this is a very important question because lot of the applied anatomy is attached to this anal canal. Okay, so we will learn it in detail. Okay, this question. Let us come first to the introduction. In the introduction you may write, okay, that it is the lowest part of the alimentary canal. Anal canal is a terminal part of the alimentary canal. Now above it is continuous with that of the lower part of the rectum. Okay, let us see this orientation of this diagram which I will show you here. See this is the pubic symphysis. The anterior abdominal wall musculature is here. Then this is the urinary bladder posterior to the pubic symphysis. This is the prostate gland here. Okay, the seminal vesicle on the base or the posterior wall of the urinary bladder, and then the ejaculatory duct is opening into the prostatic part of the urethra. This is the urogenital diaphragm, okay, and this is the penile urethra here. This is the prostatic, then this whole is the penile urethra is here. Posterior to the urogenital diaphragm, this is the perineal body, okay, it is the perineal body, and then this is the vesico or rectovesical septum, okay, rectovesical septum, and this part is the rectum here, okay, this is the rectum in front of the sacrum and the coccyx. Now this part, the terminal part here of the anal canal is the anal canal which opens outside as the anus. Now here is the anococcygeal ligament from the tip of the coccyx right up to the anal canal posterior wall. Anococcygeal ligament is here. So this is the rectum and anal canal. Now this is the, in blue color here is the peritoneal cavity here. Okay, the peritoneal reflection from posterior abdominal wall. It comes on to the superior surface of the urinary bladder. Then it dips for some distance onto the base of the urinary bladder. Then it is reflected onto the anterior and lateral aspect of the rectum. Okay, so some part of the rectum here is not covered by the peritoneum, and thus it forms a pouch in front of the rectum that is called as the rectovesical pouch. It is called as rectovesical pouch. Right. So after this, let us come to the introduction again. As I said that the anal canal is the terminal part which is continuous above with the rectum, and below, as I said, it opens on to the exterior, and here it is known as the anus. Okay, it is. Now the whole of the length of the anus, okay, from the lowermost part of the rectum, okay, till its anal opening, the length is 4 centimeter, and this is anus is directed, or anal canal is directed downwards and backward, while rectum was directed downwards and forward. So there is an angulation between the rectum and anal canal, and therefore the anal canal is directed downwards and backwards. Location we have already seen, but let us see it again. It is situated in anterior triangle of the perineum. Okay, anal triangle, not anterior. It is located in the anal triangle of the perineal below the pelvic diaphragm, and pelvic diaphragm is formed by the levator ani and coccygeus muscle, which we have already learned in the previous video. So this is the lying below that of the pelvic diaphragm, and it lies between the right and the left ischiorectal fossa. Let us see in this diagram, okay, where you can see again the orientation. Let us see, this is the perineal body which was here. Now we are seeing from below, okay. This was the mid-sagittal section. This is, we are seeing from the perineal side. In the lithotomy positions, you can just imagine. This is the perineal body, and this is the perineal membrane. That means above is the urogenital triangle and below is the anal triangle. This is the tip of the coccyx, and this is the anococcygeal ligament, and this is that anal opening as it is seen, covered by the, in this part by skin, where you are seeing, okay, radiating, okay, these folds, okay, radiating folds, right? Now, this anal canal here is seen to be surrounded by the muscle which is called as the external anal sphincter, which is forming a circle around this anal opening. You can also see that the anal opening is a vertical slit-like, okay, anteroposterior slit is here, okay. So this is the anal opening, and on either side of this anal opening and external anal sphincter, on the right side and left side, there is a fossa called as the ischiorectal fossa, on right as well as on left side. So it is situated in the anal triangle, okay, anal triangle of the perineum, okay, below the pelvic diaphragm, as I said, below that of the levator ani and coccygeus muscle which forms the pelvic diaphragm, and it lies between right and the left ischiorectal fossa. The anal orifice is between the buttocks, okay, deep inside the buttocks, okay, natal cleft, what is called as, and it is just lies in front of the tip of the coccyx, okay. The skin of this anal orifice, which is as shown here, is pigmented, usually black, okay, and throws into the radiating folds, okay. These are the radiating folds. Folds are present in the anal opening, which always remain closed, okay. Only opens during the defecation or passing of the this fecal matter, okay. So there are the radiating fold. Now this much I think is enough for the introduction, and let us move to the relation of the anal canal, okay. If we go to the relation of the anal canal, let us see what are the relation. The lower aperture anus is anteroposterior slit, as I have told you. See here, this is an anteroposterior slit is here of the anal opening, okay, and right and left wall are in a position with each other. See this right wall, let me bring it here. The right wall and the left wall of the anal opening, they are very close, so this is always closed. Anal opening is always closed except during the defecation, it relaxes. So they are in opposition with each other. Posteriorly is anococcygeal ligament or body. See, this is posteriorly, anal opening or anal canal is attached to the anococcygeal ligament, okay, or body, okay, separating it from the tip of the coccyx, okay. So this anococcygeal body or ligament separates posteriorly with the tip of the coccyx, okay, coccyx. Anteriorly, the perineal body, anteriorly it is related to that of the perineal body here. See, this is anteriorly, it is related to the perineal body. Then the muscles which are attached to the perineal body. So many muscles will be attached, which forms the sphincter, at least 3 different sphincters. Okay, parts of the external sphincters are attached here. So this is the anteriorly the perineal body, which are giving attachment to that of the various muscle. Okay, it will give attachment, perineal body, the superficial and deep transverse perineal muscle, okay. And in case of the male, it will also give the attachment of the bulbous bulbospongiosus muscle. Okay. In case of female, it will be another bulbospongiosus, which is splitted muscles. Okay. So many muscles, they are attached to the perineal body. Thus it becomes a central tendon which gives attachment not only to the anal sphincter part but also the transverse perineae, the bulbospongiosus muscle also. Okay. Still anteriorly, it is related to the bulb of the penis. What that means? If you go here in this diagram, see this diagram here, you can see that it is anterior. This is the anal part. Okay, the anus. Okay, opening. An anal canal. An anal canal is anteriorly in relation to the perineal body. Then still in front of this is the this urogenital diaphragm, and this is the bulb of the penis, which comes in close relation anteriorly. Okay, bulb of the penis. Okay, in case of the female, it will be the lower part of the vagina, because this is the male. Okay, mid sagittal section of the pelvis passing through the male, but here in between the urinary bladder and rectum, there will come the vagina. So anteriorly, the lowermost part of the vagina will also be related in case of the females. Laterally, I have already told you that its lateral relation or the ischiorectal fossa on its side. Let us understand this diagram to understand the lateral relation. Now, this is the lowermost part of the anal canal, cut in a coronal section. Okay, this is the external anal sphincters are here. Okay, I mean to say sphincters, you just remember, I will tell you in great detail about this sphincter. So these are the sphincter of the anal canal. This is the opening, and that means this part is called as the anal orifice or opening. And then you can see here the rectum and anus, they are at the junction of where the muscle comes. This muscle is called as the levator ani. Okay, which forms the pelvic floor, which takes origin from the obturator fascia covering to the obturator muscle onto the ischium. Okay, this is ischial tuberosity, and above will be the ischium part, that is obturator foramina, and membrane from where it will be taking only the lowermost part is shown here. So this is the space on either side of the anal canal. This space is called as the ischiorectal fossa, filled with that of the fibro-fatty tissue. Okay, so on either side, the anal canal is in relation to that of the ischiorectal fossa. So this is the lateral relation of the anal canal. Thus we have seen the relation of the anal canal and posteriorly, anteriorly, and to the laterally. Let us come to the interior of the anus. That is our third point in the question, interior of the anus. And for the interior of the anus, we will give a coronal section passing, I will use this coronal section passing through the anal canal. Okay, anal canal. Now, it is divided into upper and lower part. That means the part of the anal canal is divided into upper and lower. Let us see first in this diagram. This is the part of the rectum. Above is the rectum, and see, this may be the anorectal junction here, and below this is this part, terminal part of this alimentary canal is the anal canal. Okay, so from here to here at the anorectal junction up to the anal orifice, this is the anal canal. Above is the dilated part, ampulla of the rectum is there. Okay, now I will just enlarge this much part. Okay, the lowermost part of the this alimentary canal, which is called as anal canal. So this is that part which is shown here as the anal canal. Okay, anal canal. And as I said that it is divided into an upper and the lower part. Okay, so upper part, okay, upper part is this. See, this is the anorectal junction, right? This dotted line, you just see this dotted line. So I enlarge it a little. Okay, okay, so this is the part which is at this point, this is above is rectum and below is the anal canal. So this is anorectal junction, and this is part is the upper part, the upper 15 millimeter, and then it will be lower 35 millimeter is the lower part, okay, till it it reaches to the anal orifice, okay, anus, okay, anal orifice. Upper part is, as I said, is 15 millimeter long, and this part we are sitting inside the anal canal and seeing it from inside. So this part is lined by the mucous membrane, which is lined by the columnar epithelium. Okay, so this mucous membrane is lined by the simple columnar epithelium, and there is presence of the about 6 to 10 columnar folds of this mucous membrane. So long elongated folds, which in all around the circumference they are 6 to 10. So I have shown you only 4, okay, because it is in the whole circumference. So 6 to 4. See, this is one column is here, another column is here. 1, 2, 3 and 4 columns are, this vertical line indicates the column, okay, but you remember that column has the width also, though it is a line shown here, it is the width. So there are 6 to 10 longitudinal folds which are called as the anal column in the upper part, which is of 15 millimeter in length, okay. Now the lower, if you trace this lower end of this column, okay, they will unite, okay, with each other. The column will unite with each other. See this lower end, see this arch-shaped structure, they will unite with each other, okay. They are called as, okay, the anal walls, and they will form a mucosal fold, projecting mucosal fold, okay, and these are called as, so between the column, these are the anal walls. So there were 6 to 10 anal columns, and similar in the same way there will be 6 to 10 anal valves will be there. What are anal valves? Anal valves are nothing but at the lower end of this column, the mucous membrane of this column become folded, okay, and it become concentric in shape and forms a wall-like structure. If you have learned the heart, there were the tricuspid valve, okay, and this tricuspid valve were aortic and pulmonary tricuspid, which is exactly similar to that. These valves are there. Above each anal valves, there is a depression of the mucosa, which is called as the anal sinus. Now, what I will do, I have made a diagram which is passing through this anal wall. So in this longitudinal section, okay, in the upper part as well as in the lower part, this is a vertical section going, and we are seeing this vertical section from the side. So this will give you a better idea about the anal valves and the anal sinus, okay. So see, this is the wall, okay, and this is that anal wall, which I said is the folding of the mucosa, okay. This is folding of the epithelial lining with little loose connective tissue. So this is anal wall, and then this encloses a space within the wall, and that is called as the anal sinus. And here it is the submucosa, okay, this is the mucosa which has folded to form the anal valve, and then beneath the mucosa, this epithelial lining or mucosa, there is the submucosa, loose connective tissue is there, and in the bottom of this anal sinus, there is opening of a gland with the duct, okay. It is either present in submucosa or this gland may extend, these are the tubular glands, may extend into or embedded into the muscle coat. You remember the layers of the intestine, alimentary canal layers. So there is a mucosa, submucosa, muscle coat, and then outer surface was serosa or adventitia. So this gland is extending into this, okay. So the muscle coat, submucosa, and this is a tubular gland. Now this diagram must have given you some idea how this is the structure of the anal walls and what are the anal sinus. So these anal sinus, they enclose a small space, and this is nothing, thus forms the pocket here, okay. It forms a pocket like structure. Now this Anal walls gives, as I said, that in the sinus there is opening of the duct, duct of the gland, okay, anal gland. You can call this gland as tubular anal gland, okay. They are a specific name, but we don't go into that. Now coming back to these diagrams, after learning the first 15 millimeter, that is the upper part, let us come to the lower 35 millimeter part, right up to the anal orifice from this, okay, valve, okay, from this position of valve. Now this presence of this wall, okay, gives it as an irregular line, and this irregular line which is formed by the anal valves, okay, at the bottom of the column, vertical column, it is called as pectinate line. So the pectinate line is the lower limit of the upper part of this mucosa, okay, inner lining of the anal canal. So this is called as pectinate line. It is called as pectinate line. Now the lower part is divided, this lower 35 millimeter part is divided into upper and lower regions. So upper and lower region. Some of the books will mention that the anal canal is divided into three parts, okay, upper part, middle part and lower part. But here we prefer to have it into two parts only, upper part and lower part. And as we will learn later that this is the line, okay, the watershed line, which will tell us that the upper part, which is upper 15 millimeter, embryologically is derived from different portion, and then the lower part is derived embryologically from different segment. And thus they have the different nerve supply, they have the different blood and venous supply and the lymphatic drainage. That's why this pectinate line sometimes is called as the watershed line, which divides the functionally the two different parts of the anal canal. That's why we have just, used it into the three different, not instead of three different regions, only in the two parts. So we are on the lower part, which is below the pectinate line, and it is divided into the upper region and a lower region. So lower part is divided into an upper region and lower region, okay. So now the upper region of this lower part is 15 millimeter in length, okay, it is 15 millimeter, and this region is called as pecten, P-E-C-T-E-N, okay, this region is called as pecten, okay, and it extends between the pectinate line, okay, to another line here, okay, that is called as the white line of Hilton. A line will be seen, okay, which is whitish in region, okay, that's why it is called as the white line of Hilton. So this is the pectinate line and this is the white line of Hilton. With this white line of Hilton will separate the upper 15 millimeter region to the lower 10 millimeter region, okay, lower 10 millimeter region. Now this part of the anal canal, which is pecten part, P-E-C-T-E-N, middle region, the upper region of the lower part, it is covered by a epithelium which is the stratified squamous non-keratinized. Here it was columnar epithelium in the upper part, okay. This in the lower part, the pecten region is covered by stratified squamous epithelium which is non-keratinized, and it is formed attached to the deeper structure, and deep to this mucosa or mucous membrane there lies the presence of the venous plexus, okay, and that's why it looks little bluish, okay, as I have shown you in this diagram, little bluish, okay. So it is lined by non-keratinized stratified squamous epithelium. Okay, now the pecten parts looks bluish, as I said, and why it looks bluish, this pecten part? Because it lies dense venous plexus is present here, okay. There is a presence of the dense venous plexus is there in this region, okay. Now the pecten is also called transitional zone, or it is transitional area. This is called as transitional. Why it is called pecten part or the upper region of the lower part? It is called transitional because now there is an abrupt change into the epithelium. In the upper part it was columnar epithelium. Here it becomes the stratified squamous non-keratinized, and then as we will see in the lowest part, the lowest area or zone of the lower part, which is adjacent to the anal orifice, it is lined by the true skin. That means it will become keratinized, and that is the reason why it is called, because it is changing. Okay, it is changing from columnar to that of the stratified squamous non-keratinized, first non-keratinized, then to the keratinized. Let us come to this lower part. Okay, lower region. Okay, lower region, that is of the lower part. Now this is 10 millimeter in height, say length. Okay, it is just nothing but the anal opening. Okay, this is the region of the anal opening, and this content, since it is lined by stratified squamous keratinized epithelium, it resembles to that of the skin, because not only that epithelium is similar to skin, but it is also containing sweat and sebaceous gland. Okay, and then on to the outer margin, there may be, in case of males, may be seen the hairs. Okay, hair follicles and hairs are seen. Okay, at the site of anal opening. So I hope that you have understood the different regions of the anal canal. Once again I will let you know, the 15 millimeter is the part which is the upper part. Okay, where you will get the columns, anal columns, which are vertical columns about, and then at their lower ends you will see the anal valves, and deep to it is the space called, each wall is called as anal sinus, where glands opens, and then it is the lower part, where in the upper region of the lower part it is the pecten part, where there is the stratified squamous non-keratinized epithelium, and at the anal orifice. Let us now come to the anal sphincter. The anal canal is guarded by the sphincters, and these sphincters, some of them are made up of the smooth muscle, the others are made up of the skeletal muscle. So some they are involuntary, others are under the voluntary control. Okay, now anal canal is surrounded by two different kind of sphincter, as I said, and they are classified as internal sphincter and the external sphincter. The internal sphincters are made up of the smooth muscle, while the external sphincters, they are made up of the skeletal muscle. Okay, externals are made up of the skeletal muscle, and the internal sphincters, they are made up of the smooth muscle. Let us first come to the internal sphincters, which are smooth muscle in nature. Okay, now the internal sphincter is made up of the circular muscle cord. Okay, it is just the thickening of the circular muscle cord. Let us see here, the rectum is surrounded by the two muscle cord, like any other part of the small or large intestine, which is surrounded by the circular muscle cord, inner and outer. The longitudinal muscle cord is there. Okay, which are made up of the smooth muscle. Now the circular muscle cord of the rectum at its lower end, okay, at the anal canal, okay, it becomes quite thickened and forms a circular cord around the upper part of the anal canal, and this forms the anal sphincter, the internal anal sphincter. On the other hand, the longitudinal muscle cord, it becomes fibroelastic in nature. That means the muscle, all of a sudden at the anal canal region, it becomes a fibromuscular structure, conjoined tendon it is called as, and then as it goes down, here I have drawn it in the green color, as it goes down, it splits into the various branches, and this fibroelastic tissue of this conjoint tendon, okay, which is the continuation of the longitudinal smooth muscle cord, will get its attachment onto the skin at the anal orifice. And because of this attachment of fibroelastic tissue at the margin of the anal orifice, the puckering of the anal mucosal anal skin is seen, okay, as it is visible from outside. For example, I had shown you that this is the anal opening, which is having a right and left fold. Because it is a longitudinal slit opening, it remain always closed, and in the skin it shows the foldings, okay, and this is because of that fibroelastic tissue, okay, of the lung, which is continuation of the longitudinal muscle cord, okay. So this is the internal anal sphincter, which is formed by the smooth muscle of the circular muscle cord, okay, circular muscle cord. Now this internal anal sphincter is present between the anorectal junction here, right up to the white line of Hilton. See here, this is the white line of Hilton, this is the pectinate line, and this is the anal orifice is here. So here it lies right up to the anal sphincter, level of the anal sphincter. That means in the first 30 millimeter or 3 centimeter, this is that internal anal sphincter, which become thickened and form a circular band of the smooth muscle. See this? And it extend, as I said, from anorectal junction right up to the white line of Hilton, okay, surrounding to the pecten part, as well as this sinus, okay, anal valves and anal columns, okay, anal sinus, anal column, okay, and then this is pectinate line and this is white line. These two parts of the anal canal, they are surrounded by this anal sphincter, okay, internal anal sphincter. And deep to the internal anal sphincter here, extending into the mucous membrane or mucosa of that of the rectum, lower rectum, and the upper anal canal here, okay, are just here at this junction of the anorectal. There is a large collection of the venous plexus, okay, that is the veins, they get form a plexus, and this plexus, which is deep to the circular muscle cord, as well as lower down with the internal sphincter, this is called as the hemorrhoidal plexus. This is called as hemorrhoidal plexus. Right, we will learn about this hemorrhoidal plexus again, okay. So this is that anal sphincter. Let us now come to the external sphincter. The external sphincter is divided into three parts, okay. Let us divide the external anal sphincter, which is made up of the skeletal muscle, into three parts, okay. A subcutaneous part, a superficial part, and a deep part, okay. This division can be seen in this diagram. This is which is lying just beneath the skin, hence this part of the external anal sphincter is called as subcutaneous part, okay, and it is made up of the skeletal muscle, okay, striated muscle here, and it lies superficial to the anal internal anal sphincter, just superficial to the internal and just beneath the skin, hence it is the subcutaneous part. The other two parts, they lie lateral to the internal anal sphincter. This is called superficial part of the external anal sphincter, and this upper one is called as the deep part of the external anal sphincter. Thus the deep part and superficial part of the external anal sphincter, which are made up of the skeletal muscle, they lie lateral to the internal anal sphincter, while the subcutaneous part of the anal sphincter, it lies, so okay, just superficial beneath the skin,
hence it is called as subcutaneous part, okay, below the internal anal sphincter. Let us see the detail of this external anal sphincter. First we come on to the subcutaneous part, okay, to the subcutaneous part, and it lies below the, as I said that this subcutaneous part, it lies below the internal anal sphincter, okay, and below the level of white line. See this was the white line where the internal sphincter was ending, okay. So this was the white line of Hilton, and below that, below this level is the presence in the last part of the anal canal, which is the anal orifice. Surrounding to the orifice, this subcutaneous part lies, and it has no bony attachment, though it is made up of the skeletal muscle, okay, but it has no bony attachment, and it completely surrounds the opening of the anal canal or anal orifice just beneath the skin. Let us see its attachment in another diagram. Here we will see, and this is that diagram which will show you the superficial part. See this superficial part, this is the rectum, this is the anal canal. Rectum and anal canal, they are at a angulation, and this angulation is because of the levator ani muscle, that is puborectalis part of levator ani, which takes origin from the pubic bone and surrounds this rectum, lowermost part of the rectum. Thus an angulation is formed. Okay, this is not the sphincter. Our sphincter which we are talking about here, it is at the anal orifice. This is the subcutaneous part, and then above it is the part which is called as the deep part, and the deep, I mean to say the anococcygeal ligament, I mean to say that part is the superficial part, and then there is a deep part. So there are three parts: a subcutaneous part, a superficial part, and a deep part, and these three, they constitute what is called as the internal anal sphincter. So let us see, this is the superficial, that is subcutaneous, not superficial, that is subcutaneous part of the internal anal sphincter, where the muscle is completely surrounding to the anal opening. Thus it has no skeletal muscle, I mean say skeletal attachment or bony attachment. Now let us come to the deep part, I mean say superficial part of the external anal sphincter, and this is here present, which takes origin from the it has an origin from anococcygeal ligament and the tip of the coccyx, okay, and this covers the lower part of the internal sphincter between pectinate and the white line. Let us see this superficial part of the external sphincter. See, this is the superficial part of the external sphincter, okay, and it is surrounding to the internal sphincter between the white line and the pectinate line. Okay, so this is at the level of the pectinate line and white line, and it is surrounding to the internal sphincter, and I was telling that it takes origin from the tip of the coccyx as well as from that of the anococcygeal ligament. Then the band of the muscle fibers, okay, they surround this anal canal from right side and left side, thus forming a loop around it, and this they go and get attachment anteriorly to that of the perineal body, to the perineal body. So in this diagram also you can just see the presence of this superficial part of the external anal sphincter. One was surrounding, that was the subcutaneous part without any bony or ligamentous attachment, completely surrounding the anal opening. But this part which is taking origin from the anococcygeal ligament, the fibers will just wind round from right and left side, and then they will get attachment here to the perineal body. Okay, so this is that. Okay, superficial part of the external anal sphincter. Let us come to the third part, which is of the external anal sphincter. This is that deep part of the external anal sphincter. Okay, and this deep part of the anal sphincter, it lies lateral to this internal sphincter, but between the anorectal junction and the pectinate line. Okay, so that part is the deep part. Okay, and it covers the upper part of the internal sphincter above the level of the pectinate line, above the level of pectinate line. So once again I will repeat it. This is the internal anal sphincter, made up of the smooth muscle by the thickening of the circular muscle coat. Okay, so it is not under our control, it's action, because it is supplied by the autonomic nerves, sympathetic and parasympathetic. Then external anal sphincter, it has three parts: a subcutaneous part, a superficial part, and a deep part. And these sphincters, they are pierced by the longitudinal muscle coat, which continues down below in the form of the fibroelastic septi conjoined tendon, which gains attachment to the margin of the anal orifice onto the undersurface of the skin, onto the skin. I hope that this completes the sphincters of the anal canal. Now let us come to the blood supply, lymphatic, and the nerves of the anal canal. Okay, they are different from the rectum. So the blood supply is, or the artery supplying to the anal canal, is from two important arteries. The upper part of the anal canal is supplied by the superior rectal artery. See, this is a rough diagram which shows the anal canal, pectinate line, white line of Hilton's, and this is orifice part, lowermost part. So here the up to the pectinate line, okay, it is supplied by the superior rectal artery, which is the continuation of the inferior mesenteric artery. Okay, inferior mesenteric artery. So this is the superior rectal artery. This divides in many branches, and the branches, they run vertically in the columns, okay, of the above the pectinate line, okay, above the pectinate. So this is the upper part of the anal canal is supplied by the superior rectal artery. Okay, but the lower part, okay, lower part of the anal canal is supplied by the inferior rectal artery. See this inferior rectal artery, okay, below the pectinate line. It supplies below, and it is a branch from internal pudendal artery. It is a branch from. So what is the difference between superior rectal area and that of the inferior rectal artery area supplying to the anal canal? This demarcation point is the pectinate line, okay, where this sinus and the valves are present. Now, this pectinate line is called as the watershed line because it has a different embryological development. Okay, it has the separate blood supply, that is the artery and vein, and the autonomic nerve supply above. That's why this pectinate line is a watershed line. As we will see in the nerve supply, venous drainage, and the arterial supply, they are entirely different above this line and below this pectinate line. Okay, the venous drainage, if you will see the venous drainage, the upper part of the anal canal, that is up to the pectinate line here again, okay, is drained by the superior rectal vein, and this will ultimately drain into the portal venous system. It will drain into the portal venous system, while the lower part of the anal canal is drained into the inferior rectal vein. Okay, and inferior rectal vein will open into the internal pudendal vein. It will open into the internal pudendal vein. There is a communication between the tributaries of superior rectal vein and the inferior rectal vein. These are there is a communication. So there is a portocaval communication. Okay, this is in the internal venous plexus, which is between the branches, tributaries of the superior rectal vein and tributaries of the inferior rectal vein. Okay, there is a communication between these two. That is called as the portocaval anastomosis, because the inferior rectal vein is going to drain into the inferior vena cava, which is considered as the systemic venous system. Okay, systemic venous system. Now the third component is the lymphatic drainage. The upper part drains into the internal iliac lymph nodes. Lymph nodes along the internal iliac vein. So the upper part into the internal iliac nodes, while the lower part means below the pectinate line into the superficial group of the inguinal nodes. Okay, the superficial group of the inguinal node, which is present in the thigh below the inguinal ligament, there the lower part of the anal canal will go. Okay, lower part will drain, but above the pectinate line it will go into the internal iliac group of the lymph node. Now, let us come to the nerve supply. Again, this pectinate line is a waterside line. Okay, nerve supply above this pectinate line is by the sympathetic as well as parasympathetic. Sympathetic nerves comes from L1 and L2 spinal segment level, while parasympathetic they come from S2 to S4 spinal segmental level. Okay, and below the pectinate line, this part of the anal canal, that is pecten part and the lower part, okay, the lower around, this must be around the 25 millimeter part, okay, lower part, it is supplied by the inferior rectal nerve, and inferior rectal nerve takes origin from S2 to S4 spinal segmental level, and it is major sensory supply. That's why this is somatic sensation. So that portion of the anal canal below the pectinate line is pain sensitive. Above it is not the pain sensitive area. Okay, above not. So it is supplied by the inferior rectal nerve, which is a branch from the internal pudendal. Okay, pudendal nerve. Okay, it is a branch from pudendal nerve. Let us come to the sphincteric innervation. Innervation of the sphincter of the anal canal. The internal sphincter is innervated by the internal means one which was because of the thickening of the circular muscle cord. Okay, involuntary muscle. Okay, the smooth muscle. This is supplied by the sympathetic nerve. Okay, and L1 and L2 from the region of spinal cord, L1 and L2, and this sympathetic is responsible for contraction of the smooth muscle. So the internal sphincter always remain in contractile condition except during defecation, which is provided by the parasympathetic nerve, S2 to S4. Okay, relaxation by parasympathetic nerve. So this is become active during defecation, while the external sphincter, which is the voluntary muscles, skeletal muscle, they are supplied by the inferior rectal nerve pudendal branch. Okay, branch of the pudendal nerve, inferior rectal. And this external sphincter, as I said, will also remain always in contractile condition except during the defecation. See here, we have seen that the anal orifice, which has right and left lateral wall, okay, which is a vertical slit here, it will always remain in contractile condition due to this external anal sphincter, which is supplied by the branch from the pudendal nerve, branch from the pudendal. Except defecation, it always remain in contractile condition. Let us come to the last portion of this video lecture, and it is the applied anatomy. Now in applied anatomy, I have just chosen only three important one, and this is very important. Okay, the applied anatomy of anal canal is very important because you will see lot of patients in your clinical practice which will come with the complaints in the anal canal. Okay, anal canal. The first complaint which most of the people suffer in their lifetime is fissure in ano. There is a fissure. Okay, that means fissure may occur in the ano due to the, and this occur due to the rupture of the anal valves. And we have seen that the anal valves were just the folding. See here, I just will explain. These are the anal valves. Okay, concentric. Okay, pocket like structures. Okay, see this in cross section we have learned that this is that anal valve, and that in the concavity of this anal wall, or from upper side you can see a space. This is called as anal sinus. Okay, and when this anal wall get rupture, it will rupture right up to the in the lower part of the anal canal, which is pan sensitive. See here, this where the anal valves here. Okay, and if they will rupture here, this tear may come right up to the anal orifice, passing through the pecten part of the anal canal, and the right up to the anal orifice it may come. Okay, because then if it is the tearing going right up to the pecten part and lower part, and it is bound to, because this pectinate line or the anal wall and anal sinus, they are present at the junction of these. So when this this anal fissure occurs due to the constipation. Okay, when the fecal matter, stool becomes very hard, and then it passes through the anal canal, then this, because of the pocket present inside the valve, okay, it gets rupture. Okay, these valves get rupture, and then when this gets rupture, it becomes very painful, very painful. Okay, and this lead to the, and when it will become very painful, and why it will become, because below the pectinate line the nerve supplies pudendal nerve. Okay, inferior rectal branch of the pudendal nerve, which is a sensitive somatic nerve, not autonomic. So this fissure becomes very painful, and because of the pain which is there, body tries to keep that portion into the most comfortable position, and that is achieved by constriction, reflex constriction of the sphincter, external anal sphincter become constricted. It goes into the severe constriction, what is called as spasm. So it leads to the spasm of the anal sphincters. Okay, external anal sphincter. So that this is the fissure in ano. Okay. Second condition, which is also very common, is fistula in ano. Again, see this diagram where I have tried to explain you. This is the muscle coat of the anal canal. This is the submucosa, okay, of the loose connective, and this is the mucosa, which is lined by here by the tear. Tear, not tear. It is the wall, and this is the sinus. And in the bottom of the sinus there opens the gland, anal gland, which I have already described. Okay, and whenever there is an infection of this gland, it becomes large, pus starts collecting here, and then this pus may discharge into the sinus. This is the opening inside the anal canal. But then if it becomes a large thing, the infection may go into a fossa which lies by the side of the anal canal, called as the ischiorectal fossa. So this is fossa by the side of the anal canal, filled with the loose connective tissue and the fat. This is called as ischiorectal fossa. The pus may collect here because there is a lot of space to expand, and then it is either it may communicate only through the internal communication where pus may discharge into the anal canal, or if it becomes large, it may also get its opening onto the skin by the side of the anal orifice. So there may be two opening of this fistula, internal opening as well as one on outside close to the anal orifice onto the skin. So there may be abscess, this formation collection of the pus, and this may become, because there is a lot of the loose area is present where the pus may collect. It may expand in the ischiorectal fossa, may open in anal canal or may open externally onto the skin. Okay, so this fistula may have an external opening and an internal opening. This is very common because this area is unhygienic. Okay, a lot of the fecal matter contains the bacteria and this area get easily infected. Okay, easily infected. So these were two conditions: fissura in ano or fissure in ano and fistula in ano. Okay, two different conditions. Let us come to the third most important condition, which is related to the anal canal, or piles. Piles is also known as hemorrhoids. They are also called as hemorrhoids, and these hemorrhoid or piles means these are the dilatation of the venous plexus. Dilatation of venous plexus. That means I have shown you that beneath the mucosa or mucous membrane or epithelial lining, there are the venous plexus. Now this hemorrhoids or dilatation of this venous plexus, they are of two types: internal hemorrhoids or internal piles, and they are called as the true piles. Okay, they are all the true piles, and this is due to the dilatation of the internal rectal venous plexus situated above the pectinate line. Situated above the pectinate line. Let us see this, how this rectal venous plexus is situated, or hemorrhoidal plexus is situated above the pectinate. See, this was the rectal, column, anal columns and anal sinuses and anal walls are here, and this line is called as the pectinate line. So this venous plexus beneath the epithelium in the submucosa, okay, this venous plexus is here, okay, and this venous plexus, okay, if it get enlarged, then it is called as internal piles, and this venous plexus is always above the pectinate line. That means extending into the rectum also, lowermost at anorectal junction, and in this part also of the anal canal, upper 10 millimeter part or 15 millimeter part of the anal canal, these are the hemorrhoidal plexus, and if they become enlarged, they will form a protrusion, and this protrusion inside the cavity of the anal canal, which may prolong and may protrude through the orifice, that is called as the piles. Okay, that is called as the piles. So these are because of the enlargement of the internal rectal venous plexus. This plexus is called as internal rectal, and here it is a plexus which is just beneath the skin, okay, at the anal orifice, okay, just superficial to the subcutaneous part of the sphincter. This is called as subcutaneous venous plexus. Okay, and this may also protrude. Okay, enlarged venous plexus may enlarge, but this is not the true piles. Okay, this is just a prolongation or external piles or false piles. Okay, now so the dilatation of the internal rectal venous plexus situated above the pectinate line, okay, will lead to the true piles or internal piles. Okay, this will be painless. Why it will be painless? Because it is located above the pectinate line, where it is supplied by the autonomic nerve, sympathetic and parasympathetic. Hence it is painless. But this plexus, okay, when a tear will be there, the venous plexus will break up, okay, because of the injury to the heart stool, okay, passing through this over the plexus, it will lead to the severe bleeding, profuse bleeding, and this bleeding is of the fresh red blood. Okay, it is not the venous blood, it is the fresh red blood will pass through the anus. The dilatation or the formation of these true piles or venous plexus is usually seen at 3 o'clock, 7 o'clock, and the 11 o'clock position. Okay, when your patient is on the table, lying on the table in lithotomy position, okay, on the anal orifice, these positions where usually the piles are seen. Okay, we usually the piles are seen. Piles may be also in between, but mostly it is seen 3, 7, and 11. Hence, it is called as the primary piles. Okay, these are called as, and if they are in some other region also in between 11, 3, 3, 7, then they are called as secondary piles. They are called as but mostly it is 3, 7, and 11 o'clock position where the internal piles or true piles will be seen. Okay, true piles on examination, or if they will prolong and protrude, they will protrude at these positions only through the anal orifice. The external piles or false piles occurs below the pectinate line and are very painful. Why they are very painful? Because they are supplied, the area is supplied by the somatic nerve, the inferior rectal branch of the pudendal nerve. They do not usually bleed. Okay, they usually do not profusely bleed, I mean to say, and they are due to dilatation of tributaries of the inferior rectal vein. Okay, this was inferior rectal vein tributaries. They may dilate and form the false piles, but our concern is, as a practitioner, you will face is because of the internal piles or the true piles. Okay, this completes a long question on the anal canal. Thank you very much for watching this video.